2 days away. If you have kids, you know being a parent isn't easy, especially if you have a newborn who relies on baby formula. Supply chain issues were already slowing down shipments over the last few months when several brands of powdered infant formula had to be recalled due to reported baby deaths and sickness because of bacterial contamination. Now parents across the country are calling for their governors and the Biden administration to take action. They're also turning to milk banks where donated human milk is pasteurized, but donations to those centers have declined during the pandemic. Joining us now for a better understanding of how milk banks are holding up under the pressure is Jonathan Bautista, Executive Director of Mother's Milk Bank in San Jose. Jonathan, welcome to Fox 40 News at 11.
Good morning. Thank you.
How has the baby formula shortage impacted demand for donated breast milk here in California? We know that last month, retail analytics company Data Assembly reported 31% of formula was out of stock, so more and more people must be coming to you.
Yeah, it's interesting. It's difficult to know if the formula shortage is connected to the increase in demand that we're seeing for pasteurized donor human milk because when milk is requested, we're not informed whether or not that request is connected to the formula shortage. So the need for pasteurized donor human milk is constant, and we are actually seeing an increase of about 16% over the same time last year.
Wow. Reports indicate donations of human milk, though, that has been pasteurized declined during the pandemic. Has that been the case of what you've experienced at Mother's Milk, which is a facility that serves the entire state, right?
Exactly. Yeah, we out of San Jose, we provide donor human milk throughout the state of California. Throughout the pandemic, the inventory has fluctuated up and down, and just recently, December, January are typically challenging times for milk banks because of the holidays. And this past holiday season, there were compounding situations like the pandemic, bad weather, and courier issues due to bad weather that reduced the amount of milk that was being donated to milk banks. So we huddled together to increase the awareness of milk donation to get those donations back up.
Alrighty. Now, we're also hearing reports of parents diluting the remaining formula they may have left at home because they're just feeling so desperate, and health officials are warning against that, citing possible nutritional deficiencies. So, when turning to a milk bank, obviously we have all heard about all of the benefits in immunities and antibodies that the little ones get because they're getting that breast milk.
Right. So all babies deserve access to the best nutrition possible, and San Jose Mother's Milk Bank's mission is to enhance the availability of pasteurized donor human milk for all babies. So we work to make sure that we have an ample inventory of milk to be able to meet the needs of the fragile premature babies in the communities.
With the formula shortage and the need to feed babies, what is Mother's Milk Bank doing to help parents kind of manage at home? Are you doing even more outreach? I mean, people just may really be frazzled and at a loss. You have a newborn anyway, which means you're fatigued and stressed out trying to manage the new member of your family. And then something which people thought about as simple as feeding the baby has gotten kind of dicey and complicated.
Yeah. So our goal is to raise the awareness of milk donation to the same level as blood donation. Everyone knows about donating blood, but not many people know about milk donation. Also, we're educating the community on the benefits of donor human milk. In the instance where mom's own milk isn't available or isn't enough to feed her baby. So what we're doing is like you said, we're increasing awareness at hospitals and in the community. So we're working with community partners to raise that awareness and increase the number of donors that reach out to us that are interested in donating their excess breast milk. When we're able to do that, then we continue to build our inventory so that we have an ample supply to meet the increasing and constant demand for donor human milk.
You mentioned something interesting there, moms who maybe are just not making enough of their own breast milk to feed. And we know that sometimes there's a lot of shame for moms turning to formula in order to feed their baby because they feel like they should be able to do it themselves. And I would guess if you're going to another mother's milk, could be that same amount of shame. What do you want to say to people, to families, about considering this as a choice and not being embarrassed, not having shame about it?
Yeah, it's breastfeeding it can be stressful for moms, and we understand that and respect that. And I guess what I would like to say is they can reach out to us to be able to order donor human milk to provide that bridge from her own milk to human milk. So that benefit of that human milk and the bioactive nutrients that are beneficial for the babies can be continue to be fed to the baby.
Alrighty, and we're almost out of time, but just quickly, if somebody wants to donate their milk, what do they do?
So they can reach out to us at mothersmilk.org and click on our donate milk page, and the donor will fill out a pre-screening form, and we'll start that screening process with her.
Alrighty, Jonathan Bautista, thank you so much for your perspective this morning on what's become a very challenging problem for a lot of new families. We appreciate you.
Great. Thank you for having us.